Okay, so Panopto's giving me a lot of trouble today. This is my third time trying to video this, and I'm going to try my best to upload this. So for my assignment, I had APTIS Adult Day Program, and it's located at 40 Sammer Road, Toronto, Ontario. I made my points very brief, so you guys don't have too much to read, and I highlighted the main points for you guys, so I'm going to be talking more just to explain each of my slides. APTIS as a whole is a center for individuals with developmental disorders and co-diagnosed mental disorders. Later on the slide, I'm going to give you the definition of what a co-diagnosed mental disorder is. So even though APTIS targets children through to adults, the specific program is generated towards adults only. Overall, this company serves the GTA at 13 different locations, including various schools, centers, clinics, and community programs. So APTIS has many co-partners as well, including OTs, behavioral therapists, and more to provide like clinical assessments to aid in potential success of the patient. So a part of the Adult Day program, we have an adult art program that is served by APTIS, which patients get the ability to learn about art and paint and draw. There's a sensory program. Basically what that is a bunch of activities and therapy to help with sensory and cognitive abilities. It can also reduce anxiety, depressions, and co-diagnosed mental issues. There's also a community employment initiative. Basically what that is, it gives patients an opportunity to work in a community and to be included in real life work. So for example, it's landscaping or paper delivery. They also have other kinds of activities other than the art program, the sensory program, and the community employment program. So they have a VR room, music room, gym, kitchen, dance room, computer room, greenhouse, orchard, and vegetable garden activities, which I thought was really cool because that's a lot of activities for a company or an adult day program. I've actually never seen that before. So let me just go to the next slide here. So the mission statement and values of APTIS. Mission, APTIS provides enriching opportunities for people with developmental disabilities to explore what matters to them in the community. Visions, APTIS empowering people to thrive. And values, choice, respect, integrity, and inclusion. And I thought inclusion was a really good word to kind of put into their values because many people with developmental disorders have an opportunistic barriers and also a social stigma. So I thought that was a really clever word to put into their values. Target population for this specific program, APTIS targets adults 18 plus with developmental disabilities and co-diagnosed mental disorders. And then again, the definition of a co-diagnosed or dual diagnosed mental disorder is a mental health issue coexisting with a developmental disorder. So you have a developmental disorder such as autism, fetal alcohol syndrome, cerebral palsy, learning disorders, and then on top of that, they have a diagnosed mental health issue such as anxiety, psychosis, depression. So they coexist together. List of conditions that may be encountered. So when I was looking on the website, APTIS doesn't give a specific developmental disorder or disability that they work with. It just, as a whole, they said developmental disorders. So developmental disorders is a chronic disability a person presents with that causes mental, physical, or a combination of the two impairments. Developmental disorders are continuous and affects a person's active daily living. Down below is a brief list of some developmental disorders. Of course, this isn't the whole list. I just provided some of the main ones I found while researching. So autism spectrum disorder, Down syndrome, fetal alcohol syndrome, cerebral palsy, learning disorders, ADHD, developmental coordination disorder, language and speech disorders, and sensory impairments disorders. So it's important to know that developmental disorders can coexist together. So for example, someone may have Down syndrome but also have language and speech disorders at the same time. So next, members that may be involved in the patient's plan of care. So OTs to support sensory needs vital for communication, behavior therapists, behavioral and environmental risk assessments, volunteers, they help with events and APTIS teaching landscapes. So they help with activities like crafts, pizza days, art, student interns, so people that are in social work, EA school, OT school, a lot of them come to APTIS to get their internships and their hours. Teachers and EAs are also welcome and work at APTIS. So general description of medical management that may be considered. So even though developmental disorders are very commonly treated via therapy, some medications are used to help manage symptoms. So antidepressants balance neurotransmitters in the brain that are responsible for mood, so just to make someone a little bit more happy or a little bit more stable. And antipsychotics alter dopamine, serotonin, noradrenaline, and acetylcholine that inhibits certain symptoms such as delusions, anxiety, and confusion. Again, helping with those co-diagnosed mental disorders. Anticonvulsants help with epilepsy, seizures by having either a stimulating or inhibitory effect on neurons. Stimulants increase happiness and increase focus by increasing dopamine levels. Stimulants are often found with people with ADHD, but also with other learning and developmental disorders as well. And muscle relaxants. So let's just say someone comes in with cerebral palsy or rigid muscles. They take muscle relaxants just to reduce those symptoms. All these are very important to know just because if you're working with the certain populations and you look at their health history, these are some medications you may see. So benefits of massage therapy for this special population. So I found various credible articles how massage therapy helps with developmental disorders. Of course, I didn't find articles for each and every developmental disorder, but I found ones that stood out the most. So number one, massage therapy appeared to benefit the children and adolescents with ADHD. Students who received massage therapy twice per week over the course of a month rated themselves as happier and feeling relatively better after the treatment. Number two, the addition of massage therapy to an early intervention program may enhance motor functioning and increase muscle tone for people with Down syndrome. Number three, results suggest that the massage group with autistic patients exhibited less stereotypic behavior and showed more on-task and social relatedness behavior during observations at school, and they experienced fewer sleep problems at home. And lastly, significant improvements were found for anxiety, depression, vitality, general health, and positive well-being subscales of the general well-being schedule and for perceived stress among the massage participants compared to guided relaxation. So as you can see, massage therapy has loads of benefits for the developmental disorders and of course the co-diagnosed mental disorders as seen in the last statement here. So treatment considerations that may apply to this population. So health history and general considerations, potential mediator to convey information. So if they have a speech impediment, they might have an extra person there to convey their information. Talk to the patient and not to the therapist. I started this one because I feel like this one's really important. So if someone does have a speech impediment or a disability, a developmental disorder, you don't want to be looking the therapist into the eye. You want to be looking the patient into the eye because you want them to feel respected and included. Simple terminology and short-ended questions. So how are you feeling? Do you have a headache? Do your muscles hurt today? Are just simple examples. As I was researching, people with developmental disorders sometimes take a little bit of time to process your questions or your messages. So it's not like they're ignoring you. It just takes them a little bit of time to process and then they answer you. So you really have to take the time to listen and be patient. Clear tone that is even paced, that goes for every population, and avoid certain triggers that may induce anxiety. So you don't want to have a person having anxiety on the table. It's just much easier when things go smoother. Assessment and treatment considerations. You may want to keep assessments short and simple. That's self-explanatory. If the patient has many complaints, cluster testing may be an option. So if someone has a neck injury and also a shoulder injury, you may want to cluster your SOTs, MMTs, just to make it easier for you and you get relevant information based on the clinical presentation. Be wary of physical conditions. You may have to modify position and testing. That's also self-explanatory. Have a clean and clutter-free environment. That goes for even before COVID and not even just for this special population, but for every population. Be cautious of pressure. If someone has rigid muscles or numbness, a lighter pressure would suffice. So you don't want to be going deep into that muscle and causing spasticity. Massage and start light. Continuation, modify treatment positioning if necessary. If the patient has many clinical presentations, resort to spot treatments. Again, if someone has a neck problem and also a shoulder problem, you're going to work on both of those, anterior and posterior, rather than just the area that hurts, because you're not realistically going to work on that one levator scap, for example, for an hour. Provide exercises that the patient can easily perform on their own. This is really important, especially with special populations, such as people that have developmental disabilities because it gives them a sense of individuality and independence, right? So they're not always going to have a caregiver with them 24/7. So stuff that can be easily completed on their own will keep them on task, and also they don't need anybody helping them with that. So that's a benefit for that. Treat accordingly to condition presentation. So if someone has acute, subacute, chronic, follow the guidelines for those conditions and treat appropriately. That goes for all populations. And then keep in mind patient feedback. So if the patient really doesn't like muscle stripping, but they really like percussive techniques, maybe next time you can incorporate more percussive techniques. Then we have references, and then we have picture resources. And that is it. Thank you so much for listening to me.